How does anemia in Ra cause organ damage? Imagine your body as a busy city, where every part needs a steady supply of oxygen to keep running smoothly. When someone has rheumatoid arthritis, a common problem is anemia, which means there are fewer red blood cells to carry that oxygen. This happens because the chronic inflammation from Ra releases chemicals like tumor necrosis factor alpha and interleukins that interfere with the bone marrow's ability to make enough red blood cells. They also reduce the hormone erythropoietin, which normally signals the bone marrow to produce more red blood cells. Plus, inflammation causes iron to get trapped inside immune cells, making it unavailable for making new red blood cells, even if the body has enough iron stored. This combination results in anemia of chronic disease, which leaves the blood less capable of transporting oxygen. Since oxygen is vital for all organs, when red blood cell levels drop, organs like the heart, brain, and kidneys don't get enough oxygen to function properly. Over time, this lack of oxygen can cause cells to become injured and organs to start failing. For example, the heart has to work harder to pump more blood to meet the body's oxygen needs, which can strain it and increase the risk of cardiovascular problems. Studies have shown that anemia in rheumatoid arthritis is linked to higher chances of heart disease and even increased overall risk of death. Fatigue and weakness caused by anemia can also make it harder for people to stay active, which can further weaken their health and resilience. Some medications used to treat Ra, like non-steroidal anti-inflammatory drugs and methotrexate, can sometimes make anemia worse by causing gastrointestinal bleeding or reducing folate levels needed for red blood cell production. Managing anemia effectively involves controlling the underlying inflammation with disease-modifying drugs and biologics, which can help restore normal red blood cell production and iron use. In more severe cases, doctors might consider treatments like erythropoietin injections or blood transfusions to boost red blood cell levels. Overall, anemia in rheumatoid arthritis can cause serious organ damage mainly because it limits how much oxygen reaches vital tissues. This puts extra stress on the heart and other organs, increasing the risk of complications. That's why controlling inflammation and monitoring anemia closely are essential parts of managing rheumatoid arthritis. Always remember, each person's situation is unique, so it's important to work with healthcare professionals to find the best approach for your health and well-being.